Hello, I'm Mirella Cameran-Reilly and I'm delighted to welcome you today to the Hamptons Health Hotline. The Hamptons Health Hotline is brought to you by the Southampton Hospital Foundation. The hotline is a way for us to bring to you the latest thinking and knowledge on the most pressing health issues of the day. Things like diabetes, heart disease, cancer, tick-borne disease, and so on. We want you to meet the physicians who are working in your community who are available to you and serve you. But we also want the hotline to be a way for you to ask us the medical questions that you have. What are the health concerns that keep you up at night? We'd love to hear from you and answer those questions in future episodes. Please email us or send us a message via our links, our social media links, or on our website. All those things will appear at the end of the program. So February is Heart Health Month, and we've created an episode of this program called Affairs of the Heart. It looks at heart disease and why it is so prevalent in the United States and kills more men and women than anything else. It is the #1 killer in the US. We also looked at how it's the silent killer of women. It kills more women than all cancers combined. So we have already that episode ready for you. It's available on our YouTube channel. But today we have a very special guest, and we're really delighted that she came on the program to share her story. It's a harrowing life and death story which really highlights the issue of heart disease amongst women and shows us what the implications are of detection and treatment. So today I'd like to introduce Stephanie Bitis. She's a member of the community. She's lived and raised her family in Sag Harbor for over 25 years. And she is a Stony Brook Southampton patient. On Sunday, the 27th of October at 10:30 in the morning, Stephanie had a life-changing moment. And as I said, we're really pleased that she's willing to share her story with you today. Stephanie, what happened at 10:30 on Sunday, the 27th of October?
Well, Mirella, thank you for having me on the show. It started out to be a normal Sunday with me driving to church. And it didn't end up being very normal of a Sunday. So I live in Sag Harbor, as you said, and I was headed to Southampton, the Greek church in Southampton. My family had gone ahead of me, and I was in the car by myself. So I was driving along on 27, right close to the church, right in front of Goldberg's Bagels in Southampton, when all of a sudden I just started sweating. I have to admit, I thought it was a hot flash, so I just ignored it and said, oh my goodness, here it goes again. And thought about pulling over because it was something a little bit different that day, but I just kept going. Pull into the parking lot at church, and I thought, okay, Stephanie, something's really wrong with you. Rolled down the windows, turned on the air conditioning, opened up the car door, and I thought, oh, I have to just sit here a minute until this passes. Thankfully, good friends of mine came in to go to church and parked in the parking spot right next to me. Pat and Paul got out of the car, and Pat says to me, Stephanie, what are you doing? And I said, I'll be in a minute, I'm having a hot flash. And she saw something that obviously I didn't see. And she said, you're not having a hot flash, you look terrible. Can you get up? And I said, yeah, of course I can get up. And I closed up the car, put out my last cigarette, which I'll get to in a second, and we walked into church. Sat down at a bench, sweating. Now, no pain, nothing. I had no idea what was happening. There was no pain anywhere. All I felt was just perspiring. So a lot of smart folks, smarter than me in church, and they kind of scurried into inside the church, and Dr. Peter Mikolos, who is affiliated with Stony Brook Southampton, is a parishioner, Dr. Caceres, and they pulled him out and they said, something's wrong with Stephanie. And they came over and they said, you know, do you feel any pain? I said, no, I'm just sweating. Somebody brought me a glass of water. Next thing you know, somebody does this, says, call an ambulance. Stephanie's having a heart attack, we think. Call an ambulance. I guess someone on the phone said give her an aspirin. Again, no pain. I was just profusely sweating. My son was in the choir, so he actually came down. And ambulance came, the ambulance driver came in, started asking me some questions and said, do you have any pain? I said, no pain whatsoever. They put me in a stretcher, put me in the ambulance, told my family to meet me at Stony Brook, Southampton, and away I went. Got through the emergency room door like lightning. I don't even know how many people were there to greet me. It was amazing. I was in a room, and all of a sudden, I'm laying down, and 20 people are looking down at me, and they are in fast forward, and I have no idea what's going on. And one nurse looked at me and said, you need to focus right here. She said, Stephanie, you just had a heart attack in the ambulance. Time is of the essence. We have to get you in, and we have to operate immediately. And she said, you're going to be fine, but we have to move quickly. Brought my husband in. I signed a few forms, and the next thing I know, that stretcher was flying right down the hall in the hospital into the operating room. I didn't even have time to think. I'm laying on the table, I look up, and there is a big television screen. When all of a sudden I see my heart on it, of course I went and looked the other way. Doctor walked in, introduced himself, Dr. John Riley, and said, okay, we're going to get in there. We're going to do this as quick as possible. I have a minuscule souvenir.
It's tiny, yeah.
The tiniest of dots.
Just a dot, yeah.
Just a dot.
Yep.
And we went in very, very quickly. I had a closed artery, 100%, and they put in a stent. The quickest thing, I was awake, alert, not that I was watching. Next thing I know, they said, okay, you're fine, it's all over, and I was in recovery. I will tell you, Mirella, that from starting to sweat on 27 and pulling into the parking lot to the recovery room was 87 minutes.
Wow.
Which was...
That's just about optimal, isn't it? You have to be in that 90 minutes.
That was everybody ticking. I was in shock when it was over. I was already in a room, nurses everywhere. When I looked up and said, am I still alive? Am I still here? And they said, you sure were, and you were super lucky. So
wow.
Lucky, thankful, grateful. Couldn't believe that happened so quickly. And at one point, I just looked at the nurse and I said, where did the doctor come from? And she said, no, we have a new lab now. We have a new cath lab, correct? That wouldn't have been here, a short time ago. We would have had to airlift you to Stony Brook. You would have lost time. That means heart damage. This is all brand new. So our doctors are on call, and within 20 minutes, they're ready to go and in the operating room. And I looked at the nurse and I said, well, where were you? And she said, to tell you the truth, I was taking my laundry out of the washing machine.
Oh, my goodness.
Just about to put it in the dryer, and I think it's still sitting there on the floor. And I said, how fast did you get here? She said, 19 minutes. And she, of course, stayed with me all night long. 2 days later, I got up and walked out of Stony Brook Southampton Hospital. Perfectly fine. I was in the hospital 2 nights. I stayed home 2 days and went back to work on Friday.
Wow.
And
within the week?
Within the week.
You were back at work?
Within the week. Sunday, Friday, I was back at work.
Amazing.
I couldn't believe how lucky I was. Now, of course, you and I talked about how stupid I was. So
your words, definitely your words.
Was. So I tell this to anybody that will listen to me because I really believe it. I was of a generation where everybody smoked. Okay, my parents smoked. I was in house with smokers. My husband smoked. Everybody smoked. There was no reason not to.
Right.
We're Greek. You could go to Greece and smoke everywhere. The house was always full of smokers. I started to smoke at 13.
Wow.
Okay?
Gosh.
So now I'll say that I never admitted to this, but I smoked 3 packs a day for 44 years.
Gosh.
Because at 57, I walked in and had a heart attack. Never once did I say this, that I'm a pretty smart gal. Never once did I ever think, not once, that I was going to have a heart attack. I did think, you know what, I am so addicted to this, and it's as addiction as it would be drugs or alcohol or anything else. Cigarettes ruled my life. I didn't go anywhere without them in my hand. I very recently sat in a restaurant where I actually sat in the booth instead of on the outside, because I used to sit on the outside to run out and go smoke a cigarette. It was the first time I
could sit in nicely.
And I stayed in a movie the other night the whole time and didn't get up and run outside in East Hampton and smoke a cigarette in the middle of the movie. But anyway.
So it really was dominated your whole
my
lifestyle.
whole life. And I thought, you know what, Stephanie, you are so addicted to this. And one day, somebody's going to say you have lung cancer.
Yeah.
I was convinced of it. I kept saying, how could somebody that knows this, that's raising children, that knows this is so bad, but you're so addicted that you can't let it go. And I thought, you know, I'm going to have lung cancer one day. That's the way I'm going to go. Never once did I ever think, now that's the stupidity maybe. I say that the American Cancer Society does a great job, and the Heart Association needs to step it up a little bit. Never thought that I would have a heart attack. So did I have any symptoms? I, of course, have delved into it afterwards. You start reading, you say to yourself, well, how did I not know that that was coming? And then you find out that women don't have any of those same pains down their arm or warnings. There was nothing. I thought it was a hot flash.
Wow.
And next thing I know, I had a heart attack. So the nurse, whose laundry is still on the floor, said to me that night when I looked at the window in the hospital room, and I said, can we open that? Can I smoke a cigarette? And she said, Stephanie, you need to leave here as a non-smoker. And I said, I don't think I can do that. And she said, no, you can. And the next day, Dr. Reilly came in to see me. And he sat down, and I said, where did you come from so quickly? And he said, you know, you're lucky because Stony Brook, Southampton has made this commitment to the community, and we're here waiting, where years ago you wouldn't have had this luxury. And he said, but you only met me because you smoked. So you really need to leave here and never smoke again. And I said, well, I can't do that. And he said, no, you can. And someone came in and gave me a Nicorette patch and a piece of Nicorette gum. And somebody else afterwards called me and said to buy cinnamon sticks because they're like cigarettes. So if anybody was looking for a cinnamon stick in all of the Hamptons, from East Hampton to West Hampton, I bought them all in those 3 weeks out of the hospital. And it's 3 months I haven't had a cigarette yet.
Oh, congratulations.
So there you go. So
congratulations.
we stopped doing that a little bit too late. But when I think back, I think to myself, how could I have been so lucky? I was in the right place, where someone recognized quickly, where someone reacted quickly. But the minute I flew through that emergency room door, everyone was on a mission of, okay, she just had a heart attack and we have to get in there quickly. And it has a happy ending.
Thank God.
For everybody.
Thank God,
Yeah.
absolutely. How did your family react to this?
I think everybody was in total shock. My poor husband, they did bring him in right before they were wheeling me into the operating room, and instead of going into I love you, I went, whatever you do, just finish raising the children. You know?
And here's my password.
Yeah, I think that everybody was, they were as shocked, and it just happened so quickly. And yet they sat in the waiting room so reassured
Good.
that I was absolutely in the right place, that everyone on that team had assembled so quickly, and that the catheter lab was there for this reason, and that I was in the best of hands. And even though you don't want to say this is a routine thing, but I guess a stent is, you know, Dr. Riley's done a few. and that it would be fine, and it certainly was. I mean, little dot souvenir, I'll trade that any day.
So congratulations again on giving up smoking, because even though we know what we should do, it is a true addiction. It is extremely hard to give up, particularly after that amount of time, and when it is part of your whole lifestyle. How did you do it? Was it just knowing that there wasn't a choice, or
there really wasn't a choice? I mean, I now I could laugh and say that I could never trust my husband to finish the job of the 2 teenagers that we have, but I knew at that point when Dr. Reilly and all the nurses just looked at me and they said, "That's it. That's it. It's over. You just have to be strong. You have to leave here, and you can't do that again. You have 2 other arteries that are blocked, but when they say blocked, evidently everyone's arteries are to some extent blocked in life. Not anything of any concern, but that if I continued that, I might not be as lucky next time. I might not be right here in Southampton where everybody was ready to go, and that there might not be a second chance. So they said, you know, you love your family, you love your children, just throw them away, which was easy because by the time I got home, the kids had confiscated every ashtray, every lighter. Cigarettes are $135 a carton, and I had just bought one on Saturday, so they threw my cigarettes away, and there was nothing left in the house to, you know, and I've thought about it a couple of times. You're right, you know, you're having a really bad day, you're thinking, oh my goodness, where's my cigarettes? And then I think to myself, I was laying in a hospital bed looking up at 20 people trying to save my life. I can't light that cigarette again. So
well, that is wonderful. That's a huge achievement.
It's hard. I mean, and me, I would argue with people about smoking. They would, you know, come on, Stephanie, you're smarter than you stink like, say, stop it. And I would just look at them and say, no, I smoke. But not anymore.
Wow.
You just gotta stop.
It was time. You just had to. There was no choice left. So before that happened, how much did you know about, because as you mentioned, we are trying to educate. I talked about the program we put together where we talked about it being the silent killer of women, and how in February the 7th is Wear Red for Women, to try and raise the issue that women do suffer and die from cardiovascular disease. How much did you know about it then before? And the symptoms can present differently in women. So you had no clue. Did you know about the cath lab? Did you think about your heart? Did you go and see a cardiologist?
Never.
What happened? Nothing.
No, absolutely never even crossed my mind that I would ever. Everyone in my family lives to 100. So when I went to a doctor for a physical annually or anything, and they would say, you're still smoking, everyone would be shocked. You're still smoking? I mean, nobody smokes like I did nowadays. And I would say, yeah, I'm totally addicted to the whole, I don't know me without a cigarette. There isn't a photo, this is something the kids said, there's not a photo of me anywhere, their whole lives, that mommy doesn't have a cigarette in her hand. There isn't a Christmas picture with me without a cigarette. There are photos of 5 minutes before both my kids were born of me walking into the hospital to deliver the children, being more afraid of putting the cigarette out than going into labor.
Wow.
So this was this was Stephanie. Never even dawned on me. I would say, well, everybody lives to 100 in my family, which is true. It's just that, the stress of life now, and I never even dawned on me, Mirella, never.
And when you were in that moment, the hot flashes, did you not think this is going on too long, or this is too severe? I've never had this before.
That day I did. I just was perspiring, and I thought, oh, this is not right,
Yeah.
But there were
You didn't, there's no
Nothing
chest
else,
pain?
nothing.
The clutching of
Nothing.
the chest? Yeah.
I never, even though the poor young man that came in with the stretcher, at one point he said to me, "Do you have no pain?" And I said, I really don't. And he said, "But you must." And I yelled at him and I said, "I'm having a hot."
Oh, you did? You were still
You know,
convinced?
I was convinced that that's what it was, that there was nothing more going on. And, you know, again, between Dr. Mikolos and Dr. Caceres, they saw something in a educated eye that
Right.
that I certainly didn't. But no, I had no idea.
But that's terrifying, because if you thought it was a hot flash and you were experiencing it and you told other people who, you know, hadn't had that background or didn't have that training, they could just believe you and think, oh, it is just a severe case.
I think,
you know, that could have easily, you know, been
been
mistaken by not just
Yeah.
you, but the people around you.
They basically said it looked like someone had opened the garden hose.
Gosh.
So, you know, that, I guess that was it, but I really never had a pain. So, of course, then when you get out after the fact, you know, and I'm thinking, what did I miss? But really, it does. It manifests itself in women just
Yes.
completely differently. Now, back pain is a little association, so I'm thinking back, did I have a...
Yeah.
But, you know, women fluff all that off.
Yes,
you
that's
know,
right.
I'm too busy.
Yep, it will go away.
You know,
it'll
it'll
be
go
fine.
away, and, you know, I've got 20 minutes to get to lacrosse practice. I really can't worry about that. I don't feel... You just keep going.
You keep going.
And so, you know, could I have missed some of that? I don't know. But certainly not enough to have stopped me. But I think women don't stop...
No.
Regardless, they
No.
just, you know, I mean, my husband gets a cold and you almost want to hospitalize him because you know how they are. But no, I just, nothing, there was nothing there that would have even dawned on me.
And you were conscious during the procedure.
I was.
And that depends on the patient, as I understand it. You know, some people need more sedation than others. But how was that for you, lying there and all this going on around you?
I just thought to myself, okay, there's no way in the world I can ask any of them where they graduated college right now. So let's just pray that they all did well in their class. The only thing I knew was that I saw it all on that big screen TV, and I knew I couldn't look at it. So I literally turned my head. And when it was all over, and I did say, "Am I still here?" You know, I knew I was there, but it was just, I couldn't even fathom
surreal.
what was, yeah. And there was a male nurse, and I just looked at him and I said, "I'm still here, right?" And I started crying.
Oh.
And he said, "What are you crying about now? It's all over." I said, "I don't even know what just happened." You know, and you've got a big clamp here, and you're thinking, what just, you know, you have no idea that it's this little itsy-bitsy dot that, you know, because they're trying to stop the bleeding. And you zip, 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 and you're in a room, and you're like, gee, this wasn't on my busy schedule this morning. I didn't have heart attack written down.
Right,
you know?
right.
I was just going to church, and then you open your eyes, and all these people are there, and it's like, okay, I'm still here. This really worked. Look, there were years and years and years ago, way back when people would say, if you're really sick, we don't have the capability, the facilities, the hospital. We would have to leave the East End to go.
That's right.
Really have something done. And, you know, as the years went on out here, that wasn't the case. I remember my girlfriend, she has 5 children, and the last one was born here in Southampton before it was Stony Brook, Southampton. And I thought, oh boy, she's brave that she's having the, you know, and then you think as the years went on and what's happening, and obviously all the good stuff that's happening at the hospital now, and the merger and what will be in years to come, a tremendous facility when it's built, they were ready for me. I mean, that's, now that I tell people, you know, I had a heart attack, and they're like, where were you? I said, right here, and I was on the way to church. I was driving to church. And they said, and where'd you go? Stony Brook South. It's 87 minutes. I went from heart attack to stent to to recovery to joking with the nurse whose laundry didn't make it in the dryer. And they're like, how did that go for you? And I said, how did they go? Look at me, I'm perfectly,
You're back at work within a week.
I went back to work on Friday. You're kidding. In Stony Brook, South Hill. Thank God.
Yeah.
Thank God. It's a whole new world out here.
Every second counts in that situation, and time is muscle, and the quicker in that cath lab, the better the outcomes always. And it's understanding that time really counts in those situations.
And I will say the follow-up afterwards has been, I haven't cooperated because you know what, then you go back to work and you go back to that busy schedule. But the follow-up to make sure that I didn't smoke that next cigarette, the follow-up when I went to the cardiac rehab and met all the girls there, the nutritionist that's there to say, okay, you know what, as soon as you finish with the smoking business and that's behind you, let's not drive through Wendy's anymore. So now you gotta do this instead. It's a total package, which, again, I never even thought about.
That they don't just put you back in your life to carry on and try and deal with it yourself. It's hard to change those lifestyle habits, but having the support system there to say, we need to do this, we need to do that, your nutrition, exercise, those kind of things, you need that to keep you on the right track, to keep you going. So we've only got literally a few seconds left, but I cannot thank you enough for sharing your story. I hope that people have learned some things and just really appreciated what can happen, and hopefully, we'll have some more success stories, keeping people healthy, getting them back on track. And thank you so much. We're so happy that you're here with us.
Thank you.